So I was thinking, do you remember Pokemon Go?
Yeah.
Do you think that COVID was like the nail in the coffin for Pokemon Go? Because it was starting to lose popularity. It was very popular about 5 years ago. And it started to lose popularity. But then COVID made it so you can't go outside.
COVID didn't really make it that you can't go outside. People stopped going outside because of COVID.
Yeah, but for a while in the beginning, I feel like they were like, don't go outside.
No one ever said you couldn't go outside. You just couldn't be around
You're not allowed
people.
to go outside now.
I'm like, have you been in your house this whole time?
No, but Pokemon Go, I think COVID was
Pokemon Go was an era. I feel like that there was a time. That was just a good time. I feel like everyone came together around Pokemon Go for like a couple months.
The firefighters are really mean about it.
Really?
And I don't understand that because it's like, yeah, it's a nerdy thing, but at least it's getting people outside, like out of the basements.
Yeah.
You know what I mean? And we had, one of the things was our fire station had like a certain, I don't know if this is how it works, but the assumption was that the fire station like had a park behind it. And in that park was like a good place to catch certain Pokemon. And I don't know if the Pokemon Go algorithm like had like a certain Pokemon thing or if it was just like parks tended to have them. But we'd have like all hours of the night, just people like congregated outside the fire station. So that
Community.
a little bit.
Pokemon Go brought community to the
I
world.
should have gone out there and caught some with
And
them.
then COVID apparently stopped you from ever going back outside.
COVID, I honestly think the worst thing that happened, the worst reaction from COVID was the death
the
of
loss of Pokemon Go.
Go.
Okay, yeah. Well, we'll talk about that later. But
All right, well, welcome to the Back to Basics podcast. What is it? It's a podcast with me, Jason Seitz, firefighter, paramedic, RN hero, and my brother Chris. No, he's an ER physician, and we take complicated medical topics. We break them down to basics. And the good news is you can get a CE, a continuing education credit for this podcast, if you go to www.guardiancme.com, all one word, guardiancme.com, and find this episode. It's going to be called Love Bugs.
is it?
Because
I love
today
that.
we're talking about STDs.
Perfect.
Before we get to that, we got a couple announcements. One is we will be in EMS World October 2022, in case you're listening in the far future. So October 2022, what weekend is it?
12th through the 15th.
12th, yep, 12th. I'll be there.
Yep.
Do you know our booth yet?
I don't know our booth
We don't know our
number.
booth yet, but
We
come
do.
find us.
There is a booth assigned to us.
Yeah, we have
We
one.
just don't know
what
it.
the number
Yeah,
is.
exactly.
So wander around the giant hall and find us. It's in Orlando.
Yep.
And afterwards, we're probably going to the beach. So join us. What beach are we going to? just make them all come to our family plans. No, but we'll be there for a conference. We'll actually be at another conference, an IV food hydration conference, the 2 days after in the same
City in Orlando.
city. And isn't it the same hall?
I don't think it's the same hall.
So if you want to stick around even longer, we got an Airbnb for you. So
Like,
no, we will be
give me
there.
crumbs.
I don't think it should interrupt with the podcast release dates or anything like that. We're still doing every 2 weeks on Wednesdays is what we're shooting for. I don't think it'll interrupt with it, but we will be there. So come say hi.
We also owe our audience an apology because we released our cardiac medication podcast a little while ago.
Yeah, but there's only 828 people that know that we messed it
Okay,
up.
so if you are one of the 828 people who listened to the cardiac medication podcast at its first iteration, Jason and I got really confused and started talking about beta blockers and beta agonists as if they were like the same thing.
No, it wasn't even that. It was,
I don't know.
At one point, you called albuterol a beta blocker.
I got confused.
It is the opposite of a beta
I'm like, I had
blocker.
been
That was
drinking.
just one comment, though. But what got really bad was when we talked about ACE inhibitors, I said ACE stands for acetylcholinesterase. No, it doesn't. ACHE does. And then we got really mixed up because in my outline we wanted to talk about ACE inhibitors and we wanted to talk about ACHE. And we just sort of mixed them together.
And we should stop talking about it now in
completely-
case we're going to get confused again. So anyway, the
It's
podcast,
fixed.
it's fixed. It's fixed. So if you listen to the podcast now on cardiac medications, all solid, great information there. You should study that. If you were one of the 828 people who listened to it the first week it came out, just re-listen, and then forget what you heard the first time.
Burn your notes.
Right, exactly.
So-
Exactly. So cool. All right. So STDs.
STDs.
Tell us all about it.
I don't have any personal experience.
okay.
How many STDs do you have?
Currently or in the past?
Oh, I guess let's just go for the big number. No. Okay, sensitive topic, right? So we should mention a few things. We are going to be covering the pathophysiology of the most common STDs and STIs and talk about the treatment. Now, you might say, well, Jason, that's not an emergency. But if you wake up and you look at your crotch and there's bumps all over it, you tell me that's not an emergency. I get
That's
called
fair.
all the time on that. I'm sure you have people coming to the ER all the time.
Oh, yeah.
A couple things we need to mention. One is if you ever expect or suspect sexual abuse or anything involved with
I hope
that,
you don't ever expect sexual
never
abuse.
expect it. If you ever suspect it, you are a mandatory reporter as a provider. So you are required to report that if you have suspicion. So things where people aren't really willing to open up about what's going on, that can be common because it's an SDI. We get that. But if you have a suspicion that something could be going on, you are required to report that or you could lose your license. There is individual state hotlines that you can call and websites that you can go to in order to do that reporting. So talk to your supervisors, figure out what you need to do that. But same as elder abuse or child abuse, if you ever suspect sexual abuse, you need to call that. So let's get the not fun stuff out of the way first.
Well, I was going to say, it's one of those things, especially that is one of those things. I think, because I've seen this happen like in the ER where, well, maybe, but like people are like, well, but I don't want to blame these parents. I've literally had people come in with their kids, and this is like in the same genre of like reporting. So this is not, I'm not talking about sexual abuse, but like brought their kids in with like certain marks or certain things. And I've just been really honest with them and said, hey, listen, like this doesn't look good. I'm not judging, but I have to tell someone. And most of the time the parents are like, no, we totally get it.
Yeah.
You know what I mean? So like, I think that there's a little bit of a taboo about like, I don't want to report someone and be wrong. But I think like we'd rather report someone and be wrong than not report something that is actually happening.
It's not like stealing something where like if you let them on to the fact that you're going to report them, they can put it back. Like they can't unsexually abuse somebody. So
well,
like
right.
it happened.
Yeah.
Like you need to report. You need to take it seriously. Like,
yeah. And again, I think that like, I think sometimes I've seen people be hesitant to report because they're like, well, what if I'm wrong and now I blame these people? Like that is as a parent myself, I would say if you think something's going on with my child, report it. Like if I'm not doing anything wrong, then that will come out. If I am, then that will come out. And like, so I think you just have to be cognizant of that.
Yeah. And I will say as paramedic and EMT providers, if you are ever responding to something like that, we could do a whole podcast on this. I would probably rather not do it because it's not a very fun topic, but it's important to know about. And if you suspect like a rape or something like that, like there are RNs that are specifically trained to be able to like handle that evidence and handle the patient as evidence. So, we learn, put their stuff in like a brown paper bag, don't have them wash their clothes, don't have them wash themselves, things like that. So just things to pay attention to. Different topic that we're talking about today. I kind of wanted to just be able to tell like funny crotch jokes and stuff, but this is closely tied to that sometimes.
Sorry to disappoint you.
No, this is closely tied to that sometimes, so we should cover it quick. The other thing, too, is that people are obviously sensitive about talking about this topic in general. So what do you think is the best strategy to...
So I'll actually, like, not really. In my experience, no. And maybe it's different, like, when you, like, show up at their home and, like, you're a bunch of, like, ripped firefighters who walk in. Like, I'm not in that great of shape, so when I walk in with my lab coat on, and I feel like people... I just less intimidating. I've never really... Well, I'm just saying, I've never had anybody, like, if you don't make it a taboo thing, like, I'll just come and ask you, be like, oh, like, what's going on? Oh, do you have a rash? Are you having discharge? I mean, I just, like, very matter-of-factly treat it like I would treat anything.
But they're at the hospital when you talk to them.
Well, that's what I was going to say. Yeah. So I think it's different than, like, first responder. But, like, in the hospital setting, I've never really had many people be like, well, I don't really want, like, or shy about it even. Like, I just ask the questions and do the exam. And
I think sometimes, so, like, this isn't my story. This didn't happen to me. But I guess there's this story that I was told by one of my professors and I know him personally. He works for a close fire department. So I know that I verified this story. Okay. Several people have told this story now. But this husband and his wife were engaging in sexual activity. They didn't have lubricant. They decided to use an egg.
What?
I don't know why. They used an egg on him. And he had an allergy to eggs.
Oh, no.
So he, like, swelled up. But, like, when they got there, like, they didn't want to talk about it at all.
Well, that they don't want to talk about.
So, but this is apparently what she said. She was like, well, we were, like, making breakfast,
What?
And this guy, I don't want to say his name, but my professor at the time and my good friend now was like, what are you talking about? Like, she's like, like, he brought the sausage.
What? That's so
he was like,
weird.
I don't know what you're talking about. And she's like... He put egg like goo on his penis. It's like, well, that's not a normal.
How would I have gotten there?
It's not for me to judge and say what's normal or not. But I'm not saying it's taboo. I'm just saying it's not normal. That's a weird thing to do.
Yeah,
that's weird to me.
I don't know.
So, but anyway, people can be nervous about talking about that.
I don't have an egg allergy,
happened,
so maybe I'll. What's that? Just kidding.
So
I'm intrigued. But
people can be nervous to talk about what's going on down there.
Yeah. Okay, that's fair. That is true.
And the taboo of. Well, I have an STI or I have something. They don't know what it is. They're always going to assume the worst, So, they don't want to be judged as, they didn't practice in safe sex practices, or
That's true too.
they're,
Yeah. That's a good point.
out there all the time or whatever. They're a floozy. Whatever you want to call it. So,
But I think there is still some stigma around that. I think it's a lot less probably than like.
I think you have way too positive of a worldview. I've seen some
That's
really
not a
dark
problem.
things.
I'm like, you
No,
know
that's
what?
great.
Like, I think everybody should have an STD once in their life.
I don't.
Just have the
Sounds
experience.
terrible.
No, but I get what you're saying. Like,
Non-judgmentally asking direct questions is the strategy that we're trying to get at.
And maybe
right?
that's what I'm saying. So like I've never had a problem when I don't feel weird about it or taboo or have a stigma. So like when I come in and just ask very real questions and like I'm there to help, like I think people are pretty receptive to wanting to share.
When I think a lot
help.
of times like filling in the blanks before they have to give details is helpful. So like that's why knowing these conditions is kind of useful, because you can be like, hey, like, are you having like discharge?
You can
from
ask
your
the right
penis
questions.
That smells bad. Because, and they're not gonna like be like, hey, just so you know, like some stanky stuff. Like that's
true.
That's like an embarrassing thing to talk about. So when you ask those direct questions to narrow it down,
That's a good point.
I feel like it.
Well, because when I ask questions like, are you having discharge? What color is the discharge? It's much easier for them to answer a question than to be like, let me tell you about everything I'm experiencing right now. That's a good point. Here's a question though. I guess I never thought about this before. It makes sense that like in the ER, people come in for this all the time. Do people call 911 for STDs all the time?
Wouldn't you though? If you didn't
if you didn't have any
like,
healthcare background, I guess like
anything. I mean, I'd call you
Mm-hmm.
and be like, something's going on. But a lot of people don't have an ER doctor brother that they can call.
that's true. So
they
all
call
people call
911.
me and ask me for advice and then still take their people to
People
the
call
ER,
me
though.
when they see squirrels in trees, because they're worried about the squirrels. Like, of course, they're calling about STDs. Like
That's a
people
good
call
point.
911 for the stupidest
Okay,
reasons.
fair enough.
And I'm not saying it's stupid to call 911. Some of these are very serious infections that you need to get checked out. They're not emergencies. Let me be clear. Like nothing's going to happen. Like if you don't get it done right now, it's going to kill you. But you
So-
should seek medical treatment. And a lot of times, the only people's access to medical treatment is through the 911.
So to that point, most of our listeners are paramedics, EMPs. Why do they need to care? Why do they need to keep listening to this?
What do you mean? I just explained it.
No, I'm saying that
'Cause
you
they're gonna
just
get
said like it's
calls.
not an emergency. They're going to get calls, but like why is it important for them to know the differences between the other? Like why can't they just put them in the back of the ambulance, take them to the emergency
Well, because
department?
medical education, for one, being a connection to the community, and some of these you need to, in the same way that we talk about every emergency, you need to get the ball rolling and questions asked and information on the condition to tell the ER doctors, because some of these are like, I need to take antibiotic to get it fixed up, and some of these are like, if I leave it, my liver will shut down and I will die.
Right.
So like, there's some significant difference between these different STDs and STIs, and I know that like the big
like
one
you're
we talk
correct.
about.
Well done.
Stop testing me in my podcast.
Sorry.
So, no, and that's an important thing. And there can be complications with it, like especially if you have a pregnant patient that has an STI or an STD.
Sure. Yeah.
It's a major issue. You can have like early onset pregnancy. What am I
Early
getting at?
onset
You can have,
pregnancy.
like, You
Exactly.
can have like basically.
It can precipitate.
Why can't I think of a premature you can have a premature birth, which is bad.
Yeah.
You know,
Or the
we're
baby
really,
can be
after
born.
the cardiac medications thing and now this stuff, we're really wearing our reputation.
Yeah, I
down.
know.
So,
We're losing audience. No, and that's a really good point too. Again, because we talk about it all the time, like going back and like asking, because it would be really easy. You show up, they're like, "Oh, I've got some discharge." You're like, "Not an emergency. Throw them your ambulance, get in the hospital." Right? Like you can do that, and probably a lot of people do.
yeah.
The question is, and we always say it, what separates like of okay EMT paramedic from like an excellent provider, and that is being able to go a step further. Again, like to your point, there are some like comorbid things that can make this really problematic. Like if you're pregnant, if you already have certain, like if you have diabetes and also like get STDs that are bacterial, like the chance of that becoming a worse infection, obviously, you know what I mean? Like, so there's lots of stuff like that, again, like I think I would argue is the responsibility of first responders to start to get that information and advocate. So,
Well, and two, some of these conditions, like outbreaks, happen like weeks later. You know what I mean? It's not like they just notice like a little bit of itchiness or something. And like you can have very serious, very life interrupting signs and symptoms from some of these things.
Yeah.
Even though they're bacterial infections, just like if you had the flu, that can be life threatening if you leave that be, you know. Same thing with these. You know?
Same
It's
with AIDS.
infections and infection.
exactly.
Not AIDS. We're talking about AIDS. It's a different thing.
Okay, all right.
And that's
all right, let's jump in. What are the
let's
first
talk
things we're
about.
talking
First, we're going to start with let's just review transmission real quick. So
sex.
yes, but also blood and some skin to skin. You know what I mean? So there's no special transmission with sexual activity. Like there's fluid transmission, but whenever you can have fluid transmission through sexual intercourse, you can have the same fluid transmission through
oral, and there's oral
blood,
fluids,
like
fluids,
a lot of that stuff.
Yeah.
So just keep in mind that like you can get these diseases without necessarily having sexual activity. Like especially some of them, but you can almost always get these if you were born during like an outbreak that your mother had.
Right, that's why the pregnancy thing is important.
Yeah, and that's another thing with the whole like non-judgmental. Not that we should be judging these people for contracting STIs in the first place, but like the assumption that this person practiced unsafe sex and that's why they're sick now is an incorrect assumption.
Yeah.
You know what I mean? That is an incorrect assumption. There's
now, I will say, just because, like I said, I don't want people to get confused. Like these bacterial ones are not like bloodstream infections that can be like you know what I mean. Some of these can be transmitted through blood. Most of the bacterial ones that we'll talk about, it's fluid transmission. So sexual intercourse, like it can be like you said, if you're having like oral sex, things like that, like these things can all like, it's not just like penetration and stuff like that, but it's not like if you got somene's blood on you who had gonorrhea, you're going to get gonorrhea. So I just, I just want to, you know,
that's hilarious.
So that would be the worst, right. Actually. That would be super.
And then it's worth saying, practice safe sex, people.
Absolutely.
Condoms.
That's pretty much it.
Well, and that's another thing. And I have this in the questions, like for the CE, like just because you like wear a condom doesn't mean that you're perfectly safe. It's the same thing as like, unless you're practicing abstinence or you're in a hazmat suit or something like that, like you're not always going to prevent. If you are having sexual intercourse with somebody with an active STI, it doesn't matter if you're wearing a condom. There's still a danger there. There's still a threat.
Yeah,
there.
Like, which is why, like, also if you have an STI, like, again, I get that there's stigma around it, maybe a little bit, but like you need to be honest with your partners and make sure, you know what I mean, that sort of thing too. Like,
and if you're getting a treatment for an STI that you contracted to your partner, what should you tell your partner to do? Go get treatment.
Yeah, they also need to get treated and tested and that sort of thing too. So cool.
All right. So
that sums it up. Have a great day.
First one on the docket, chlamydia. There'll be an image coming up on your screen now. So chlamydia is a bacterial infection it is commonly called the clap. Do you know why it's called the clap?
No, but I'd love to hear why.
The clap. So I found this out the other day and I thought this was exciting. Clapier. I could be pronouncing that wrong, but in French, clapier
sounds right.
Is a brothel.
Okay.
So the idea was like you would go to a brothel and you would contract the clap because brothels.
Way to precipitate stigma, man.
I'm just saying that back then they didn't use safe sex practices.
I mean, they were just going to brothels. I mean, like, right?
Prostitutes.
Probably a lot of people were actually practicing safe sex, and then there was the people going to brothels.
Listen, statistics show that 20% of our listeners are active prostitutes. So I'm not trying to like wear down their reputation.
I'm like, first of all, why? we need to investigate that.
I'm like, it's one of the other podcasts that I do on the Guardian podcast.
Okay.
So, also though, there's this like archaic treatment, I guess. Now I don't know the treatment. It says something like you would like slap something onto the penis and it would like make a clapping noise. You like clap it, or the testicles or something really weird. It didn't work obviously, but it would make like a clapping noise. So they call it the clap. So two
Interesting.
reasons.
Okay.
So
very cool.
So what does it look like? Pain and discharge. So pain in the area, in the genital area, and then there could be like penile or vaginal discharge. How do we treat it?
Antibiotics.
Good. What specific antibiotic do you know? Because I don't.
Man, here's
me testing you.
Dang.
There is a specific. So here's what's important is gonorrhea, which we'll talk about next. Gonorrhea has very similar signs and symptoms: pain and discharge. It's also a bacterial infection, so its treatment is also going to be antibiotics. So concentrated on treatment is going to be like handling like.
It's Rocephin and azithromycin, and I can't tell you.
I think gonorrhea is Zithro. I don't know for sure though.
I think it might be Zithro. So to your point though, they're both very similar.
Yeah. So how do we tell the difference out there? And does it matter?
So it doesn't matter to you guys in the field necessarily. So the questions you can ask around chlamydia versus gonorrhea is like the type of discharge. So chlamydia is going to be like a thinner discharge. Gonorrhea is like a thicker. I mean, like it doesn't matter to you guys in the field. They both need antibiotics. It matters to me a little bit because of. I'm just super into it. No, I'm just kidding.
Yeah, I knew it was coming.
No, it doesn't matter. It matters a little bit to me because, like the complications down the line of one versus the other. And even that, I guess I'm...
Well,
when I
the
really
one
think-
antibiotic won't treat the other one. So,
Right,
like,
so,
yeah,
but-
it's important.
But at the same time, we just treated all this. So when you come in, there's one test. And actually what's nice is that it used to be like, I used to have to like do a swab to like get like discharge. Yep. Not comfortable for anybody.
Oh my God.
But
Do you
now
have to
you
go-
can do,
I'm not trying to just be gross, but do you, like, for a male,
you go in the
I guess
tip.
do you
and
have to go up in?
swab it around. Yeah. Inside.
Oh my God.
Not comfortable. But now there's a urine test. So now there's a urine test for chlamydia and gonorrhea.
You heard it here, folks. You're here first, folks. It's okay now. Not as bad to be
Right.
tested.
Right. So now there's a urine test, and it tests for both chlamydia and gonorrhea. The reality is that a lot of times most ER, we don't get those results back right away. So we just treat you for both.
So you just give like a more shotgun antibiotic.
You get 1,000 milligrams of azithromycin as a pill, and you get a 1 gram dose or 2 gram dose of Rocephin as an IM injection. You can just get back out there. No, but you know what I mean? Like that's what we do. So we treat them, we treat both. So
How long should you wait?
how long should you wait?
Yeah, before getting back into it. Not literally. I'm just saying, like, before you engage in sexual activity again with your partner, how long should you wait until the antibiotic's over with, like the 7 to 10 days or whatever?
Well, because it's a one-time dose of both.
It's not just good to go.
No, you should go get retested until you're test negative.
Okay.
Is really what the recommendation is. So you should go and follow up with your if you came to the ER, follow up with your primary care doctor, get your urine tested again. So yeah, so to your point, like it doesn't really matter the difference between the two. But if we were only treating one, yeah, it would make a difference because the one antibiotic doesn't work for the other one. So
Yeah.
we just happen to give.
It's
antibiotics for
disappointing
both.
though, because we know that like using those shotgun antibiotics and using multiple antibiotics, like that does build resistances and stuff. Like we're always in medicine trying to use specific antibiotics for things, so it kind of sucks that we do that. But
Yeah. The problem is too, though, is that because we don't get the results back right away,
Yeah,
sometimes
it's
it
not your
takes a day
fault.
or two. Like I don't want to let your infection get worse.
Yeah.
And I'll jump into that. And that's because, especially in women, bacterial like chlamydia gonorrhea can turn into like very severe like sepsis. So that infection can track up into the uterus, into the fallopian tubes. You can start getting abscesses. I mean, like it can be really, really bad.
we see that all the time when we start seeing a patient like develop a UTI in the hospital or something like that. That can quickly turn into sepsis because those infections are hard to catch in the early phases, and then they get systemically ill.
Well, so a UTI though will track up into the bladder and like kind of get into the bloodstream as like general sepsis. These bacterial infections will actually cause like and I've seen it in like surgeries before where you have like abscesses and like pus in like the like uterus and fallopian tube. I mean, and you could if it goes that far and there's complications like that, like women can have trouble getting pregnant someday. Like they could like you know what I mean, they can really like
or die.
Well, right, that too. So like it can get really bad, which is why, and this is one thing I will point out, if someone has discharge and that kind of thing and a fever, that's an emergency now. That
Okay.
is something that you should consider and like taking people's temperature. Like if you come in, you got a fever and like vaginal discharge or penile discharge, like that is a serious infection now, and like you're gonna need to be hospitalized and like so again. So it's that's separating yourself as a great medic versus you know what I mean. Like those are the things you need to start thinking about. So
Gotcha. Okay, next on the docket is
what do you prefer? Which one's your favorite?
Stop it.
Okay, sorry. Next
is syphilis.
syphilis.
Also bacterial. Sexual contact and blood products can transmit it. So if you got blood from someone who had syphilis, you can get
So syphilis, yeah, is one. Like
this
you're
is
not
one
going to
of
really
those.
get like gonorrhea from someone's blood, but syphilis, yes.
Yes. Signs and symptoms. These are sores. So basically in the first few weeks, you'll get like sores in the genital area. Then you can basically get like a whole body rash. And then if you leave it be, you'll get like internal organ damage. So pretty serious. Another reason why, again, not an emergency in the acute phase, but certainly something that we need to educate patients on and get them to the ER to get treated, right?
We don't see syphilis much anymore.
Good.
Right. Well,
So
because
when were you cured?
what's that?
When were you cured?
Right here. I was like, it was March of 21. No, just because, like I said, we historically, syphilis was one of these diseases where, like, once we figured out what it was, we were like very robust in treating it, and like so we like there's not much of it out there. If that makes sense.
There's like herd immunity to it.
Yeah, kind of. Like there's just like
gotcha.
we're kind of protected a little bit, but it still happens.
Treatment's penicillin.
Yep.
the first antibiotic.
Right.
So
That's why.
Goes to show
that's-
you we probably knocked it out. Pretty
yeah,
well.
that's what I mean. Like we've caught it early, and it's
Good. Yeah. They did seem pretty serious though. Internal organ damage is a lot more serious than, some
yeah, because
bumps.
syphilis is the one that will, like said again, go through your bloodstream and start to cause liver, kidney, heart, even that type of stuff. So
Yeah. Next is HPV. This is our first viral human papillomavirus. Something like that.
something like that. Human papillomavirus.
Thank
Is that what you were trying to say? I thought you were.
I just didn't remember what it was.
Okay, all right.
You don't have to be so mean.
I'm sorry. I'm sorry.
All right.
Human papillomavirus.
Signs and symptoms, warts or nothing. So here's the issue too, is like a lot of these infections you could be asymptomatic for. So that's why it's important to practice safe sex, like communicate with your partner, like know if your partner is sick and you're not, you still need to go get tested and treated because you could have this and you could be carrying it and not have symptoms.
And human papillomavirus, like I think there's probably like human papillomavirus 1, human papilloma, like one of them, like you said, like is genital warts. That's easy to see. That is actually one that like doesn't go away.
Yeah, so there's no cure for it.
Right.
You can be vaccinated against it.
Right. And the reason we created we can create vaccines for viruses. And again, this is a virus. So we created a vaccine for this one because it can be spread around and be asymptomatic. And men a lot of times are very asymptomatic and spread it to women and don't even know. You know what I mean? So so that's why we vaccinate. I think we vaccinate women.
It's recommended. It's not. They're not forced to in any way.
No. But I think it's like
recommended
I think
though,
it's
women at the
12
age of like 12 or 14 or something like that.
Yeah, we vaccinate against it.
So that's something you can get vaccinated. There's
And boys can get vaccinated against it too.
Yeah. And then there's wart treatment basically for it. Like if you have like outbreaks, you can. Yeah, they concentrate on treating the symptoms, not curing it because you can't cure it because it's a virus.
Exactly.
It's one of those viruses like mononucleosis or anything like that lays dormant in your system.
Right.
The next one is, I'm going to let you read it because I butchered it before the podcast.
Well, we just call it trick.
Okay.
But it's trichomoniasis. Trichomoniasis. That's something like that. But that's a parasitic one.
Trichomoniasis. This makes it, I don't know why, and this is terrible, but it's extra gross that it's a parasite.
Mm-hmm. Yeah, it is it's a parasitic infection. It can cause some discharge, like a thin discharge.
Well, and specifically a foul-smelling vaginal discharge.
Yeah.
And men will not have symptoms of this.
Right.
And it's itchy.
That is actually one that's more common than you think. So like when we text for like chlamydia, gonorrhea, a lot of times we'll see trick as well.
See, I feel bad about saying it was gross.
They kind of
just saying the idea that a parasite in your body at any time is gross.
Oh yeah, like a tapeworm.
Yeah,
one of the most terrifying things I've ever heard.
I think that's gross. If you've had one, or if I've had one, no big deal. It's not your fault.
Right.
But it's a gross thing that happened to you.
Right.
That's all.
Yeah.
You're not gross, people. We love you.
There you go. Perfect.
Yeah. So you can't. Well, you can treat it with antibiotics. So it's not a virus. It's not a bacterial infection. It's a parasite.
It's a parasite, but you can treat with antibiotics.
Okay.
Yeah.
And then, specifically foul smelling, which is why it's important to ask those kind of specific questions. Because if you have chlamydia, you have discharge. If you have gonorrhea, you have discharge. If you have trick, you have discharge. But without the extra question of like, does it smell bad? That might be an awkward question, but hey, does it smell bad? Is it foul smelling? You fill in the blank for them. They say, oh, you know what it is?
Yeah.
That can turn you on to the idea of, okay, this is trick then, and we need to test for that and go from there. But it sounds like it's just a kind of all-in-one test. A
lot of it we test all at the same time.
Okay.
So another thing, and I'm going to throw this one in here, it's not a sexually transmitted disease, but it gets thrown in here a lot, which is why I want to bring it up, is bacterial vaginosis. So BV. So bacterial vaginosis is like a vaginal infection that causes discharge and can cause discomfort and things like that. And a lot of people think it is sexually transmitted.
Oh, okay.
It is not a sexually transmitted disease. You can get that even if you've never had sex. The reason it sometimes gets confused is that if you're having sex or having a lot of sex, like it increases the chance that you're gonna get BV.
It's just like if you swim in a lot of public fountains, you probably can get a UTI.
Right, and you can get BV, but like literally, and the reason it's a
you're exposing the environment to that area.
It's a normal bacteria in like the vagina, but again, if like the pH balance gets off kilter because you're swimming in fountains apparently or having sex, then you can get an overgrowth of that bacteria. So that's BV. So something to throw out there, just because like a lot of women come into the ER thinking they have like chlamydia or gonorrhea, and they just have BV. And there's like a little bit of like a nuance of like, and it's like more of like it's like more of like a fungal. We treat it with like antifungals almost, but like it's not really a fungus though. So, but anyway, all that to say is that these symptoms you can still have even with non-STDs.
Well, and you could probably save some families with that knowledge.
Yeah,
because the thing is like, you know what I mean? Like, if all of a sudden I get it, I'm going to assume that I got it from the only person I'm having sex with, and that person's not supposed to be having sex with anybody else. Right. So, like, then you're, like, accusing them, like, you gave me chlamydia.
Right.
You know what I mean? You cheated on me, and it's like, nope, I just swam in the fountain with you the other day, remember? You know?
I don't know why we decided that specifically is like, but yeah, okay. So, but just to bring that up.
Interesting. So, that's BV. We talked about trick. And now we're moving on. And this is,
sorry, it's like, I almost feel bad bringing it up in an STD conversation, because this is what happens. Like, it's in your textbook in the same area, because it's like a vaginal infection with discharge. So it gets looped in when you're learning about those things, which is why a lot of people assume it's an STD. It's not an STD. And now I've added it to our STD lecture, and now everybody really screwed this up.
That's all right. I will edit it in the notes.
Okay, thanks.
Herpes. So a couple different types of herpes. Just so you guys know, herpes 1 is just cold sores. Like, that is orally transmitted. You do get that from other people, or from
rid of it.
Putting your mouth over a drinking fountain.
Or a fountain.
Yeah, or a fountain. The spout of a fountain when you're swimming in them.
Right.
All that kind of stuff. So, yeah, like, that is technically like
it's a virus.
Herpes is a virus. It is not genital herpes. So if someone has cold sores, it does not mean that they are also having sores on their...
It doesn't mean that they can give you genital herpes from their oral herpes.
They can give you oral herpes, though. So if someone's like having a breakout and they're all scabbed on their mouth, you know, maybe just shake hands for a day until that's gone.
Don't get in the fountain with them.
Genital herpes is herpes type 2, though, and that is sexually transmitted.
Correct. And that is like blistery, sore, like...
Yeah, so itchy sores, they'll actually like scab off, and then like,
it hurts
slough
too.
off.
Like, people who have herpes outbreak, like, it hurts a lot. And that one, like, I feel really bad for people, because, like, again, like, you know, you have sex with someone, they give you herpes, and you just like have this for life now and have these outbreaks. So antivirals, so like acyclovir, valcyclovir, we give these antivirals.
I have in the notes that you can take antivirals. It won't necessarily like cure it. It can help with outbreaks.
Yeah,
but like you can't really cure a virus. This is one of those things that may like lay dormant, and you might have it for the rest of your life. That's like where you see those commercials where it's like, I have not hepatitis. I have herpes type 2. And the person's like, and I don't, and we're trying to keep it that way and control outbreaks.
Yeah, so you can't. So that is one thing. So with herpes, if you're not having an outbreak, you can't really spread it. So, you know what I mean? So, like, obviously you should, if you're having an outbreak, refrain from having sex so that you don't spread it. If you're not having an outbreak, then you're not going to give it to anybody. You know what I mean? So, like, to your point. So that's something that's like important for people to know. Mm-hmm. The other thing is that some people will take kind of antivirals like on just kind of like a long-term basis
to prevent outbreaks.
To prevent outbreaks. So you could do that as well.
So that's herpes, and then
we're going to skip hepatitis, I think.
Why?
Well, so we can briefly talk. Let's briefly talk about it.
Hepatitis is a liver infection. One of the many versions of hepatitis is sexually transmitted.
Right.
That's all that we're going to say about it.
Yeah.
How about that?
Maybe I think we should do a
podcast
on just hepatitis.
So hepatitis, basically, your signs and symptoms of hepatitis is going to be liver function dysfunction issues. Mm-hmm. So like turning yellow and painful urination and stuff like that. Yep. And then your treatment is going to be, there's a vaccine for this one. You can take antivirals. If you have viral hepatitis, you can get a liver transplant if your liver doesn't work anymore. Mm-hmm. I don't really know if you can call that a treatment, but I mean, it is a solve.
Right.
So we'll talk about hepatitis in a future podcast coming to you soon. Mm-hmm. It's not on the schedule. I don't know when it's going to come. It could be months.
Maybe years.
Okay. Last thing, AIDS, HIV. Now, HIV is a sexually transmitted disease.
Virus.
Yeah.
Yeah. I'm just saying.
Okay. Yeah, it's a virus. Yeah. But it causes AIDS, which is an autoimmune disorder.
So AIDS is like all the symptoms of the virus. If it's left, like we call that syndrome.
Two things have to happen in order for you to technically have AIDS. You have, three things, I guess. So you have to have HIV.
Right.
Second, your T cell count has to be below 200.
Right.
So your immunological system has T cells that help you fight infection and defend against itself. If that drops down, your defenses are now low enough that we can call this an autoimmune disease now.
Right.
And the other thing is that if you have like a major infection along with HIV that's unchecked, we know that our immune system isn't fighting that well. We have a major infection now. Guess what? It's AIDS now.
Yeah.
So like
the
full-blown AIDS, quote unquote, full-blown AIDS.
Full-blown AIDS.
Is HIV with your immune system now compromised. So the treatment for HIV is essentially giving you antiretroviral therapy.
Antiretroviral therapy.
Thank you. Antiretroviral therapy, or ART therapy. ART therapy. If you just paint, that HIV will not turn into AIDS.
That's really bad advice.
Yeah, I don't know why I read that wrong. Antiretroviral therapy. That can prolong it turning into AIDS, but you cannot cure HIV. I don't care if you're Magic Johnson. You haven't cured your AIDS.
No, but you with antiretroviral therapy nowadays, you can keep your viral count so low that it will never do anything. It will never affect your immune system. It will never give you any symptoms, and you can live your whole life and never have any issues.
But what if you get I don't think that's the case, because if you get an infection from something else and you have HIV that you're keeping in check with antiretroviral therapy, you technically have AIDS because you have a major life-threatening infection.
No.
Why?
Because it has to be, your viral load has to be high enough.
But it is high enough because you contracted a virus. I went to...
But it's not. So I think what you're confusing though is it's certain viruses. It's certain infections. It's not like you got the flu, now you have AIDS because you had HIV. So it's certain opportunistic infections where you and I wouldn't get them because we don't have, our immune system will always fight them off, like cytomegalovirus. And there's certain diseases that if my T cells are so low, I can't fight them. I can't fight certain diseases that a normal immune system could. Okay. That we define as AIDS because clearly the viral load is high enough and the T cells are low enough.
Okay.
So I think that's what it is. It's not like you get any disease, like you got COVID and you happen to have HIV, you don't have AIDS now. You know what I mean? It has to be the viral load and the T cells. So HIV, the virus, attacks our white blood cells, specifically the T cells. So we can, with the antiretroviral therapy, we can keep the virus count so low that it's not destroying T cells in a way that would compromise our immune system at all.
So am I wrong, though, to say that you could get COVID? COVID could then, because it's attacking your body and exhausting your immune system, allow those viruses that we usually beat to be able to grow and reproduce and become stronger in the body, and then therefore...
No. So the antiretroviral therapy keeps the virus.
You can get septic. I can cut my leg in the fountain and get septic from that. And if I'm septic and I have HIV and I'm taking antiretroviral therapy, my immune system is taxed at this point to the point where my T cells are going to drop no matter what, and then those viruses are going to pick up. So to say it's impossible to get AIDS from taking ART, I don't think is correct.
It is. Because again, for AIDS, it's autoimmune dysfunction syndrome, right? It's like a syndrome. But again, you can only have AIDS in that definition if you have HIV and your T cells are, like I said, less than 200, and your viral load is high enough where you start to get these opportunistic infections. So I can still get septic. It's not even taxing the same part of my immune system. And my immune system's fine because the virus is low. The antiretroviral therapy is fighting that virus, keeping that virus at bay. So by definition, I don't have AIDS. I'm not more predisposed because I have the HIV virus either. Okay. That's one of the miraculous things about antiretroviral therapy is that, back in even how many years? Even when our parents were young, AIDS was killing people. And even in Africa, AIDS killed hundreds and thousands of people. Mm-hmm. But then with antiretroviral therapy, literally you can get HIV, which was this horrible thing that people was killing people. And now you live your whole life no problem at all, and there's not any issues.
So that's the whole thing is if you get HIV now, don't be scared.
Right. Absolutely. Yeah. Because it's very treatable now, which is you'll always have it. You can't cure it. Jeez. But so that's the miraculous thing about the antiretroviral therapy. So
cool.
Yeah.
Well, you heard it here, folks. Chris Seitz thinks it's fine to get HIV.
Yeah, absolutely.
He's got you.
Yep. Just give me a call. Give me a call. Get you on that art, But no, for real. It's one of the, I don't know if we talk about it enough, but it's one of these huge medical,
like vaccines.
Right. Yeah. I mean, yeah, absolutely. I mean, because again, like AIDS was such a pandemic of like it was killing off people all the time.
Gotcha.
So
interesting.
Yeah.
So there you have it, STDs. Yeah, we will revisit hepatitis in a future podcast because I think that there's a lot of different types of hepatitis, but it's same pathophysiology sort of, an end game pathophysiology when it comes to liver damage. So
yeah, so I think from like a summary standpoint, I mean, like, so you have bacterial STDs, you have viral STDs, like maybe some parasitic ones. Again, the big key takeaway here is one, being comfortable just asking the right questions and knowing what questions to ask, understanding that if left untreated, these can be very severe, and understanding that they're also very treatable if caught early, right? So it's again like creating an atmosphere in healthcare where we can talk about it and we can bring it to people's attention and we can get it treated and we can, practice safe sex and make sure that it doesn't spread. You know what I mean? Like that's kind of really the message. I think especially from a first responder standpoint, this is one of those really easy things to just be like, it's not an emergency, whatever. But again, what's going to separate you from the crowd is like, do you know when it could become an emergency, what to look for, and can you create an environment for your patients where they do have the ability and the safety to be able to express their concerns and get the treatments they need and that sort of thing.
Well, it's the same thing. If you have a UTI, it's not an emergency. But
right.
If you have a UTI and a fever and you're about to go septic from it, or you leave it unchecked, or you're in a certain age group, or you're immunocompromised, like those comorbidities can really turn that into an emergency. So take it seriously. Practice safe sex. And don't play in fountains.
Yeah, I think those are the major takeaways.
That's it. Again,
to summarize
take a listen to this podcast at www.guardiancme.com for a free CAPC credit. That lets you take that to whatever your licensing body is and count it as your continuing education credit. So,
and again, as always, if you're studying for the National Registry exam, EMT or paramedic, check out www.guardiantestprep.com, and we will help you get through that exam and make sure you pass. So, cool. See you next time. Hey guys, thanks so much for taking a listen. If you are studying for the National Registry exam, we're here to help. We have a National Registry prep program to help you pass that exam. Check us out at guardiantestprep.com. If you'd like continuing education credits for listening to our podcast or watching this on YouTube, follow us at guardiancme.com. 100% free CAPC credits. No matter what state or country you're in, we're here to help. So again, we thank you so much for listening. We hope you have a wonderful week.